Yes, vitamin D protects your heart, but only if you take it properly, and if supplementing correctly with vitamin D could reduce your risk of a heart attack by more than half. Heart attack death risk is very high in our society, and while most cases are preventable, few people choose a heart-healthy lifestyle. There is a hormone you make from sunlight that can affect this disease, vitamin D. I'm Dr. Borja Bandera, endocrinology and nutrition specialist, and today we'll review a new clinical trial that could change everything. You're going to learn the conclusions of the Target D, the reasons why vitamin D protects your heart, and how to get the most out of it. First, we know for sure that cardiovascular patients have lower levels of vitamin D. This is an observation similar to saying that patients with cancer or autoimmune diseases have less vitamin D, which is absolutely true. The problem is that association is not causation. Have you heard that 1,000 times, right? So far, clinical trials on vitamin D and cardiovascular prevention haven't found much, unfortunately. For example, the D-Health trial confirms this, but today's trial is very different. Look, it was done in people who had already had a heart attack before, that is, in secondary prevention. If this has happened to you, your risk of another heart attack is much higher. And the pressure that patients feel to do things right or as best as possible is enormous. Let's try to help them with this trial. Scientists from the American Heart Association in 2025, very recently, just a short time ago. This study corrects the main methodological error of past studies on vitamin D, giving everyone the same dose and not aiming for a target blood level. Here, 85% of participants started with levels under 40 nanograms per milliliter, which main guidelines consider perfect. Then, they were randomized into two groups. In the first group, their levels were raised with different doses of vitamin D until they reached the range between 40 and personalized doses. Called 19, they saw the second group. There was no monitoring. Stellen. Let's remember that the threshold for vitamin D deficiency is 30 nanograms per milliliter. The threshold for vitamin D insufficiency is 20 nanograms per milliliter. And the dosage for the UNELA vitamin diagnosis is OAI first fracture. That calcium rises a lot in the blood? Well, the conclusions were striking. Patients raising their vitamin D levels to 40-80 nanograms per milliliter lowered their risk of another heart attack during the study period by 52% compared to those who didn't control it, that is, to less than half. Giving everyone the same vitamin D dose is a mistake because a standard dose doesn't guarantee results. Also, current vitamin D trials usually don't check what levels the patients end up with or if they've corrected the deficiency. If we give everyone 2,000, one might go from 20 to 25, another from 20 to 32, and another stay at 22. Why? There are genetic differences in vitamin D metabolism that affect plasma levels. Many people have digestive absorption problems, which usually aren't adjusted for, and that's why you can't control the levels of additional sun exposure that add vitamin D to supplementation. A person who gets 2,000 and doesn't go outside might fall short, while someone else who gets 1,000 and spends 4 hours outdoors might have enough. And nowadays we know that our exposure to the sun is erratic, inconsistent, and problematic. Our relationship with the outdoors is basically poor. However, the Food and Drug Administration's standard recommendation is 800 international units of vitamin D daily. However, what we've seen in the Target D study is that 52% of participants needed to take more than 5,000 units per day to reach optimal levels. This can only be done with supplements, and I want you to understand why vitamin D is vital for the heart. I don't care if you get it from synthesis, supplements, or food. Look, vitamin D, as I explained in this recent video, has tissue-dependent effects. Bone health can be optimized with moderate levels of 20 to 30 nanograms per milliliter. Cardiovascular and immune health require more, they require higher levels. That's why the participants chose the range between 40 and 80, which was defined by the researchers. Vitamin D lowers inflammation in endothelial cells and macrophages, slowing atherosclerosis progression, which causes most heart attacks. Vitamin D promotes the production of nitric oxide and therefore vasodilation. Vitamin D regulates the renin-angiotensin-aldosterone system, helping lower blood pressure and arterial wall stress. It also boosts insulin sensitivity and may help reverse type 2 diabetes progression. This study has several limitations, mainly similar to what happened with the melatonin study. Do you remember? It's an abstract presented at the American Heart Association which hasn't been peer-reviewed or published in a journal, for now. Until this happens, we have to take the findings with a grain of salt. The study also showed a reduced risk of heart attack, but not of death, stroke, or heart failure. Most patients were white, 90%, and male 78%, averaging 63 years old. This matters because darker skin produces vitamin D more slowly, so Black or Hispanic people may need higher doses, though this is still preliminary. This study shows the dose required for optimal cardiovascular health is higher than current health agency recommendations, and that rather than a fixed dose, we need a personalized dose that brings us closer to a target range, which in this case was 40 to 80 nanograms per milliliter, although we will always recommend lifestyle over diet. The truth is, and it's undeniable, that reaching these levels of vitamin D in our current context almost inevitably leads us to supplementation. You now have more info to empower your health. See you next video. Big hug. Keep empowering yourself.